Bro, 82% in range in the last 2 days.
It's awesome. It's awesome.
Yeah. Check out today. This is the last 24 hours, man. I feel pretty good about that.
Rightfully so.
This is Bolus Maximus. I'm Brandon.
And I'm Matt. Thanks for tuning in.
This is my first time hosting a podcast. How about you?
Yeah, for sure. Any idea how we're supposed to get people to listen and subscribe to this podcast?
Just by saying it?
Subscribe.
You're tuned in to Bolus Maximus with Brandon and Matt. Don't forget to comment, share, and smash that like button to stay up to date.
My name is Brandon A. Denson. And this is Bolus Maximus.
What's up? All of my boluses. What's up?
All of my Bezos. What up?
What up, boluses and basils? Basils and boluses. Welcome to the show. My name is Matt Taro. We're back to talk a little bit more about health insurance. We talked last time about the system, kind of how it's structured, what your options are. But today we're going to talk about how it's broken.
Broke. In
so many places. Realistically, though, I think from our experience right now, we're talking about access and the fact that it is broken, who lacks access to get what they need on a regular basis. So,
facts.
You've got the most recent experience, Brandon.
Yeah, and it's
share with the people. Share with the people, please.
It's been an interesting journey. Just trying to set up appointments, trying to get referrals, trying to get insulin, trying to get CGM sensors, and insurance not approving it, and then having to try to get reapproved. It's been a headache, but it makes me realize how privileged I've been in situations with jobs, how privileged I was when I played professionally, when I played collegiately, how easy it was to get access to these things that I needed to help me live or thrive or live my best life with diabetes.
Yeah. I think that access is probably the biggest topic that we see in the community as far as who has access to insulin, what that price is, everything like that. So it's I think the word frustrating comes to mind. It's annoying how frustrating it is because it happens on a regular basis. But I think when we talk about who's got access to the insulin, who's got access to CGMs, who's got access to pumps, is usually because if you have good health insurance or if you have money, you have access to it. And so with health insurance, especially with health insurance, commercial health insurance, that is, if you have access to all of the things that you need, you really don't think about what it would be like to not have that.
And that's the privileged part, right?
Right. So we talked a little bit about this before, and I'll say it again so that everybody listening can understand. I had gone with the wind and just carried through life up until about the time I was 20-something years old, where I was 29 years old when it really hit me because I lost my health insurance. Everything before that I had. My father was a otolaryngologist and an ear, nose, and throat physician in the state of Rhode Island. He worked at the hospital. He had doctor's parking, which meant that if I went to the hospital, I was parking in the doctor's lot, and we were walking straight into the hospital. Everybody knew who he was. That's not normal. And my mother was a nurse, and so having that combination of mom and dad being in the healthcare system, not only was my care really good, but I never really wanted for anything as far as health. So in a way, I ultimately felt uber privileged. There's privilege and then there's a level above that. And I felt that. I knew that. And coming out of California before my father passed, and I lost my job, I was like, I really don't know what it's like on the other side. And after I lost my job, I lost Cobra health insurance because I didn't pay the first. I never even had it. It was like the handoff, right? You're a football player, and then the running back never even touches the ball, and that's what it felt like. And the coach was going, "You dropped it. You didn't even touch. If it touches your hands, you should get it. You should catch it." Right? That's what my brother used to say. If it touches your hands, you should catch it. It was in my hands, and I dropped it, and I think that was a blessing in disguise, because at that point I needed to go get on Medicaid. I applied and didn't get it right away because I didn't write a letter or something stating that I was a diabetic and that I had absolutely no way to get insulin and anything except paying out of pocket. And then the second time they approved me, but like I needed to go through that to understand how broken the system was.
I think you mentioned something very important too, far as like letting them know, or whoever you're working with, like far as, I guess it would be like a caseworker that's over your your Medicaid, or if you're over 65, your Medicare, because they need to know that you're diabetic, because they will push things a little bit faster. You know, that's very important to make sure you let them know, because if not, it's not going to be priority, you know, and it already takes a lot of time, because there's a lot of people with chronic illnesses and a lot of people that have diabetes. So
the word insulin is like the boogeyman. Like straight up, if you mention something about having diabetes and you say, I have diabetes, I need insulin. Whoa, oh, I did not, I'm so sorry. I didn't, you know, let's see what we can do. That's not always the case though. I say, like in California, Southern California, I was in a good position where it wasn't a super busy time of the year. It was right after the first of the year, and things were just kind of lining up where I was able to take my time, apply for Medicaid. Funny enough, as I just said it, I applied for Medicare first, not realizing that I had done that. And the guy called me and he was like, "How old are you?" I was like, 31. So you're gonna get Medicare? He's like, this is for people 65 and older. That conversation lasted about 60 seconds. Before I got off the phone, I was like, cool, thanks. Let's never talk about this again, until right now.
But I guess it's easy to mix them up. I know I mix them up. I understand now.
I was gonna say, bro, I'm very proud of you. You got it right this time.
So this is how I look at it. If you're under 65, you need Medicaid. If you're 65 and older, you need Medicare. I don't want anybody to take this the wrong way, but the way that I kind of put it together was like, Medicare means elderly care. So that's how I.
Is that how you put it together?
That's how I differentiate.
Did you put that together all on your own? We had that conversation last night. But working in healthcare, in putting people in a position where they can get things that they need, you understand very quickly that the elderly community, people over 65, seniors, they need the most care, because they may not have somebody who's watching out for them, who's doing something for them. Whereas we, the younger generation, the people who are on Medicaid, even them, it doesn't mean that they're well-abled or that they're doing everything for themselves. A lot of people have problems. And you can get on Medicare if you're under 65.
Okay.
Because I've talked to people who are on Medicare that are under 65. The specific way that happens, I do not know. I would prefer not to speak on how that happens. However, I know I've talked to some people who are like in their 40s. I think it has to do with the level of care that you need, and possibly you're applying, or the application process.
Or probably maybe. Well, we're not going to get into it because we're not medical licensed professionals.
Disclaimer.
We do not work for the state or government agencies. We are just talking about things that affect a lot of people in the United States.
I don't work for the government. Do I have to say that explicitly? I don't work for the government.
I think they're listening.
Oh man. So I like the whole idea behind why the system is broken and who doesn't have access to it. If you think about commercial health insurance, you get money taken out of your paycheck to go towards health insurance. So every month you're technically paying for it. It's just at such a premium because your company is taking a lot of the responsibility there. So you only pay, I don't know, when I say only, it's still a lot. I mean, you could still pay a couple $1,000s before you even touch a deductible or an out of pocket. But I think like every month, let's say it's $120.
Which is not bad.
No. And that goes towards your insurance. In reality, that's that's $1,200, and so I mean you're looking at least like $2,600 at that point, right? $2,400. My math is horrible.
So I just break it down, 1,200, and then we just throw the 20s on there.
So in reality, though, if you think about what it is that goes towards, you end up paying for everything at that point. You get dental, usually you get vision coverage, you have hospital if you go to the hospital,
ER.
and you have your physician's visits. It depends on if you pick a PPO versus an HMO. And for everyone listening that doesn't know the difference between a PPO and an HMO, a PPO is you get to choose who it is that you go and see. And it's usually a higher deductible plan, meaning that you pay more out of pocket up front to make those choices. When we say we have to see a specialist, an endocrinologist is a specialist. They specialize in the endocrine system, which means those people are either going to get picked by the patients themselves, or patients are going to be given a list of names that they can choose from, and that's who they have to see. So, there's a lot of different ways where you end up looking at your options and going, oh, I really want to see this person. You don't know about the rest of the people that are options for you. So, let's just, we talk right about 10 minutes here about getting an introduction about what it is that we're discussing. But when we talk, I'm 34 years old. I'm a white male. I've like I just explained what my situation was growing up. I can't imagine what families that underserved areas, a black family who's making minimum wage with kids who are on Medicaid, you're not paying for things the same way. You may get things that you need, but that's a whole family now that's supported by that one healthcare system.
That entire system. So I can only imagine it being like a headache for myself personally, going through things. And it's fine, you navigate, you figure out how to get through it because these are things that you need. But that is difficult, it's difficult. I don't have kids, I'm not married, I don't have a significant other, but I can only imagine being, let's just say, in a single parent shoes, trying to juggle those things, with having one child, but let alone one having multiple children.
Yep.
So now everybody has to kind of go through that same system. So now you have to find care for, your kids and also yourself. Like the challenges that I'll say in the last couple of weeks, just going, trying to get CGM sensors, trying to get insulin. I mean, I'm still battling, trying to get the right amount of insulin right now, which is not going to be ready until Monday. They gave me one vial, but it's going to last me like 9 to 12 days, so realistically, my far as just getting the nurses and, the people that I'm dealing with to understand, it's like not being angry or anything, but just letting them know like this is an issue. Like I'm fine, but like what would somebody need to do if they didn't have any insulin and they couldn't get it until Monday, I think that's the bigger issue. It's not that they can't get me my insulin, which I need, at some point, but it's just really understanding that if I did not have any insulin and you're telling me I have to wait till Monday, it's a potential that I could die. It's a potential that somebody out there. They
never ask, yo, hey, excuse me, how much insulin do you have in your fridge at home? It's more like, this is what you can get right now. Do you have any questions?
Exactly. And then it's always, well, we have to call the pharmacy, or we have to get a pre-auth, or we have to do this and we have to do that. It's like, people don't have time. They don't have time to do that. Like, and I think that's the frustrating part, understanding that I'm not in that rough situation, but I know somebody else is out there that is,
A lot of people.
a lot, so
Yeah.
like it's the system is broke. And, we talked about this other day. Like, it's good to be able to have Medicare or Medicaid, but it services so many people. And I think what happens is it's flooded. Like, it's flooded. So not only are the doctors
Overloaded. Yeah.
the doctors are like stacked with appointments, but then so are the specialists people need to see. So not just the primary care physicians, but we're talking about cardiovascular. We're talking about ophthalmologists. We're talking about endocrinology. Like, so many things that are associated with diabetes, and like all of these people have to go either because they have complications or they're borderline for having issues. Like, it's just so filled that there's no way that all of these people could get the quality care and time that they need. It's unrealistic.
It's impossible.
It's impossible.
That's why doctor's visits for a lot of people are like 20 minutes long. You really don't unpack anything. It's like getting into a hotel room and starting to unpack, and someone goes, "All right, you're done. Leave." You're like, "I didn't even stay my whole time. I paid for a night." And they're like, "Yeah, you've been here long enough. Goodbye."
Get out of
Like,
here. Yeah.
You can't unpack the things that you need to get at the bottom of your bag to talk about, and it just doesn't happen. And I know that's a weird analogy, but like, you really don't get to unpack the things that they need to hear to help you.
I mean, because the first time I saw the doctor last week, when I saw her, it was like, we still have items on the list that need to be taken care of. So we scheduled an appointment next week, which is this upcoming week. So it's just like, I came in for this appointment to get things taken care of, and then I have to come back next week. So it's just like,
You're like, "Oh, we're done? It's
like,
over?
Like, I still
She's gone?"
Like,
It's like a celebrity doctor. It really isn't. And shout out again to all the doctors and nurses who give a lot of themselves every day for their patients. We're not talking about you being bad people. We're not talking that you don't get it. I think you understand more than anybody being in that position. But geez, from the patient perspective, you're like, "It's already over? It's done?
and
We're
I-
done?
and
It's done?"
and like you said, it's not bashing any doctors. It's figuring out. We understand that the system is broke. If people don't think that it's broke, then like there's an issue. Like, if you don't think that this particular system is broken, like healthcare in the United States is broken.
Yeah.
Like, there's no ifs, ands, or buts about it. There, like, the fact that we have to figure out how do we get insulin and we need it. Like, we didn't ask for this disease. We didn't,
Nope.
we didn't ask for it. So we shouldn't have to struggle to get it. We shouldn't have to you shouldn't even have to have a job to have good insurance to be able to live. And at the end of the day, like, we have the doctor's back, and we want to figure out how can we help this system get better? Like, what can we do?
And we haven't really talked about this, and this isn't something that we've brought up or even said, but Medicare for all is going to be placed on the hot seat in the next couple of years. Now that President-elect Biden is in a situation where it's a topic of conversation. People want to know whether or not we are one of few countries with this system where you can pay money you can lobby against what people need just based on having money. And big businesses and big corporations pay lobbyists to prevent you from getting what you need.
It's crazy.
Is that right? Is that accurate?
It's crazy.
It's simple. Like, we should have access to things. Why don't they want access to certain things for everybody? Well, it's because if we don't provide that access and we go in a more roundabout way, it's going to make me more money. And that's how the government feels. I don't want to list any names.
We won't.
Mitch McConnell. But that's those There are people that are taking money directly from big business. There are people that take money directly from insulin manufacturers, right? And the reason that they get money is so that they don't pass laws, so they don't make it easier for you to get your insulin. And then if the little guy wants to fight, that's us, individual people, we would have to pay a lot of money to even get in the ring and then get our ass whooped. Yeah. So making noise and informing people like you have options. If you don't think you have options, let's talk about where you are and what you're doing. My phone line is always open. My email is always open to hear from people. If you have questions about healthcare, I am not a professional, but I deal with it every single day. Meaning I could talk you and tell you about things that you may not know. I can inform you like I've informed some patients on the phone, but it's very situational. Depends on where you are.
And I think the most important thing is like even though you don't have that professional expertise, you have the personal experience from actually going through it. You know what I mean? Like
that too.
So that's that comes in handy as well, because it's not like you're trying to teach somebody how to navigate the system and have never went through it. You know?
I don't work for anybody in that sense that like I'm gonna make money off of any of that stuff.
Just want to show you.
I just want to educate you. Like if we're in a cave system and it's very dark, I got the torch.
Correct.
So we understand that it's navigating that type of system is extremely difficult. It's very frustrating, like we said in the beginning. It's very annoying, and I think something that just came back to mind is it's not just about going into the doctor's office. It's not just about all these things. Have you ever called the doctor's office and then not gotten anybody? You can't get somebody to pick up the damn phone?
That happened to me yesterday.
So the stress associated with not having a phone call answered when you believe that that person is in that position to answer that call, like I'm calling you not because I want to, not because I just felt like calling you today. I'm calling you so that I can schedule something because I need it.
Hey, Doc, what's going on? I just wanted to see what you had going on for the weekend.
Yeah, nothing, but I'm not going to be around. Sorry. Like you feel like they're inaccessible in a way. So there's a barrier between the doctors and the patient. And a lot of time it's the staff at the office. And the doctors, when you really think about it, again, growing up in this world, my father was unique in the way that he dealt with patients. He would make house calls. He was available. We had all my family would come over my house. Like that was something that I grew up around. So I understand where there's like a level or need rather for people to show up and say, hey, I'm here for you. But the doctors don't interact with the patients other than in the room that you see them in. And that they don't take calls normally unless they're on call.
Yeah. And I think that depending on who you are, some people just want to get their scripts, get their medicine. But I think people that have detailed questions, they want to know what's going on. They're like really in tune with everything. Like sometimes they don't even get that time of day. Like, and
it's so weird.
And it sucks. It sucks. It really, really sucks. But, that's why we're doing what we're doing. We want to be able to help out in any way that we can, or show people the way, or if they're stuck in a situation, to try to help them navigate through it. Like it's not easy, but that's why we have this community here.
It's like taboo to talk about it, and I can't understand why it would be, based on like I just gave a little bit about my background. I told you where I came from and but it's so taboo to talk about health insurance. Because it has everything to do with how much money you make. It has everything to do with your access to what you need. It shouldn't be so taboo to talk about it. It shouldn't. Now, granted, it's not hard for me to talk to people on the phone when they call in to get a pump from us. Me, not you, me. When they're going to call and get a pump, then they're asking specific questions based on their needs. Everybody should be doing that sort of and having that conversation like all the time. You should be asking whoever you can. The insurance company is obligated to work for you. If you're paying them, they work for you. And that's a weird way to say it. I would never say something along the lines of like, hey, you work for me. But you got to believe that an organization that should be doing things for you at the very baseline, at the very bottom level, that they should be doing things for you. If they never do anything for you and you're trying to make it multiple steps up, you're on your own. Now you're fighting against the system that's not helping you, which is incredibly difficult. So that mental stress becomes an added layer or an added element in your care for yourself, because now if we physically get upset, or if we get upset rather, and it's all physical, and we get like, oh, I'm so angry, and it's just like our blood sugar is going to go up. If you start to get stressed, your blood sugar is going to start to go up. That happens all the time. I can't tell you how many times I would like scream into pillows or like yell in my apartment after hanging up the phone. I would say some very choice words about how that person's rest of the day should go. But like that sort of stuff, it happens every day to people in your community.
For sure.
And if you don't think about it, like think about why somebody in your office might be upset. You don't have to ask them, but understand that if that person has a family member who needs urgent care, who needs help, and they're not getting it, that's very stressful.
Very stressful.
So it weighs on your caregivers. It weighs on your family. If the kids aren't getting the care, in event of emergency, put your oxygen mask on first before helping your kids. I mean, the airlines just might
put
hate
your
children.
mask on first, cuz.
Right? Airlines hate kids. But like, you got to believe that you're supposed to help yourself first. You can't do that if you're a single parent and you have children that you have to worry about. You put your issues to the side. And if you're doing that as a diabetic, if you're doing that as somebody with cancer, if you're doing that as somebody who should be getting better care, then what is going to happen when you get to the end of the line? Your kids are going to believe growing up that that's how it should be.
Yeah.
Screw that.
Yeah, you have to,
Changing
we'll always say it. You have to be your own advocate, your own best advocate. Don't expect a doctor or a nurse or a specialist to do things for you. If they say they're going to do them, follow up. Follow up, document it. Make sure you have it, because at the end of the day, you're in control, ultimately of your life, your health, and the way that you manage this disease. Ultimately nobody else is. But, Matt, you said something very important that is, yes, you, sir, Matthew, as always, your doctors work for you. A lot of people are like, oh, what does that mean? Like, your doctors work for you, regardless if you're coming out and you have the best insurance. They're supposed to help you in any situation. They're supposed to listen to you, just like they're supposed to give you the best advice, and they're supposed to make sure they're attentive to you for your needs, the things that you need. And it's as simple as that.
I would pose this question to anybody listening. When was the last time you got a second opinion on something? When was the last time you even had an opportunity to get a second opinion? You know how common that phrase was back in the day? Oh, did you go get... Oh, so-and-so said something about my... Did you get a second opinion? I feel like I've heard that like fizzle out, because the ability to go see somebody else is not really there. It costs so much. It costs so much time. It costs so much energy and effort on both your part and on the doctor's end. Again, shout out to the doctors helping the individuals in this world and are doing the right thing. We appreciate you, but you got to understand that second opinion should be nonchalant. Well, Dr. Denson over here, I don't know. Would you like to be called Dr. Denson?
Dun, 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 dun.
Dr. Denson over here told me that I was going to need to have surgery on my hip, and I don't believe him. And now you're stuck between doubting the doctor that you just saw and like thinking that you know what's right for yourself. Go see another doctor. The problem is not everybody can do that. You should be able to.
Or it's just it becomes a huge process from seeing this doctor to getting a referral to another doctor. And like you said, the time in between, how much time is it going to take from me seeing this person and then actually being able to get access to see another doctor for the same thing? It becomes not a priority.
Right.
it becomes not a priority. So,
and you believe it to not be worth your time. To your point. Oh, it's not worth my time to go out of my way to go see another doctor, to wait a week, to do this, to do that. And you're like, no, well, realistically, you should. Anytime, I've only ever seen one endocrinologist at a time. I don't cheat on my endo, but I could if I wanted to. Sorry, doctor. But like I could. And that,
oh man,
that doesn't, what? You think she's watching this? Oh my God. Like that. If I'm not, I value the conversation I had with the certified educator and the nutritionist that I've seen. The first time I saw her, it was really good conversation. It was almost more like a therapy session where I got to get everything out on the table. The second time around, when she called me, she went right back to revert right back to the normal stuff that she would tell every patient. And I was like, did you forget everything we talked about at first? Like, I just got diagnosed with gastroparesis.
It's not one size fits all.
That's what I was looking for help with.
It's not, and I think that's the biggest thing from different culture backgrounds to different demographics. Not trying to throw race in here, but it's different. It is very different.
For sure.
And then the biggest challenge is that if doctors don't fully understand the background of an individual, they're giving them general information that doesn't really apply to them. Mm-hmm. So, I'm not trying to bash any doctors or specialists, but if you don't understand their background, you might not have their best interests at hand. And it's not saying it's done on purpose, but it just shows you that you have to put more time into that patient and understand that patient. It's more than just, this is this is your A1C number is good. Oh, this is the A1C, you need to get it down. Okay, we know that, but what are the action steps to actually get it down?
How many black doctors are in black communities?
I talked to them about that the other day. I'm waiting on a call back because I want to. And it has nothing to do, like I said, with race, but I need somebody that understands my background,
right,
that can put me on the right path that I need to be on. So I know if I feel that way, it's probably millions of other people across the country that need that same type of guidance.
This is specifically about race because it not in a bad way, but in a highlighting what is happening. For sure. Way.
Should we wrap this up then?
I feel like I'll leave with this, that if you're a white American and you see a white doctor, the chances of you trusting and believing what that doctor has said are pretty significant. If you're a black American or somebody of color, Asian, Hispanic, and you see a white doctor, chances are you're probably going to listen to what they said and understand what they said, but are you going to trust every word that comes out of their mouth? And do you feel that they truly have your best interest at heart? Is it even feasible to have doctors from every background in the communities that they serve? I mean, I wish the young kids right now, they weren't, no offense to anybody making rap music or driving nice cars, but I wish that we wanted more doctors and less TikTok stars.
Facts. And
I wish that was the type of thing that's the type of thing where people recognize that there is a path. There are a lot of powerful black individuals in the healthcare space. And shout out to every single person who does things in their own community. My question was not meant to be derogatory or disrespectful, but I think overall there are far more black communities that need more black doctors.
For sure.
Than anything.
For sure. It's almost like you look at it, you want to get in shape. I love this analogy because my mentor, aka trainer, used to say this to me all the time. Like if you're trying to get in shape, you're not gonna get trained by somebody that doesn't look like they're in shape. Like it's just, but it's the truth though. Like if I weigh 300 pounds, I'm not gonna get trained by somebody that weighs 500 pounds. Like it just doesn't make sense. And I think people, they like all seriousness, like I'm not even trying to be funny. Like I'm not gonna go to somebody that I don't believe can take the best care of me, because now I have to question myself on like, what am I doing? What the heck am I doing?
And you question, is that person taking care of themselves?
Exactly.
If Jack Black was my doctor, I would go to him. Shout out Jack Black.
Hey, I would see Jack Black too.
But I feel like there are people that are comfortable with themselves, and I think that there are people that are not comfortable with themselves that pretend to be, and that's a whole nother topic of conversation. But if you're pretending to be okay with what's happening in your healthcare system, your healthcare system, and you're not comfortable with it, you should change it. And if you don't know how to, contact us. We'll talk you through it, or we'll have the conversation. We'll be the wall you can throw the ball against to come back to you with ideas. Like, that's what we want to be for people. Can we be it for everybody? No. But I can tell you where we're going to start. And that's something that we've talked about today. And we have a project that we're going to be working on, and that community that we're going to be working with specifically needs the help. And it's going to be very impactful for them, hopefully, in the long run. And then the young men and women who live with diabetes and other illnesses that need that sort of help. So
it's a marathon, not a sprint. It's going to take time, but the first thing is to acknowledge the issue, be aware of it, and then put action steps behind it, to make it happen.
So I think that was that the bell for today? Yeah, that sounds like our 30-minute bell, although it's been almost 40. So we'll wrap up and talk a little bit more again, the next topic that we can highlight. But, it'll be a little bit more deeper, and it'll be a little deeper rather into healthcare, specifically about where you go and who you see. I appreciate everybody that's listened. Again, we're not medical professionals. We speak from where we've come from. We know what we know because we've been through it. As Brandon points to his heart, or more of like his sternum.
Yeah, that's like my sternum.
Yeah, your heart's a little bit. Yeah. We're going to play Operation and learn more about the human body. But listen, if you're listening today and you got anything out of this, share this podcast, share what you hear from us. Think about it. Go home. If you're already home, stay home. Because of COVID, and think about it and try to understand where the family next door is, the family down the street is. You don't have to necessarily approach every person and say, hey, what is your healthcare system? But if you don't feel comfortable and you want to talk to other people about it, it can be a topic of conversation. And it should be more and more. It should not be taboo. It's easy for the healthcare system to keep you from talking about what they're doing to us.
Speak up. Be your own best advocate. Period. Nobody can tell you that you're wrong. When we see these doctors, when we see these specialists, and we see these nurses, at the end of the day, it's not their agenda on what they need to push. It's your agenda on what you need.
Oh, we'll get to that.
Oh yeah, I've said that.
They get money for certain things. They got an agenda.
We know.
We'll talk about that. Who gets money from who, and why do they prescribe you X, Y, Z?
For sure.
So let's talk about that next time. Thanks everybody for listening. My name is Matt Taro. I'm part of Bolus Maximus, and we do what we do because we can, and we want to help you.
Brandon A. Denson, Bolus Maximus. We're signing out. As always, keep it 100. If you don't know, now you know. Bolus Maximus is not sponsored by anybody, but if you would like to get involved or sponsor a podcast,
please reach out to us at thebolusmaximus